Hello, my name is Dr. Ron Bose. I'm a medical oncologist at the Siteman Cancer Center, and my specialty is breast cancer. Thank you for joining us today. I hope everyone is staying safe and healthy during this challenging time with the coronavirus. A number of you have submitted questions to us about cancer and coronavirus, or COVID-19, and we wanted to answer a few of those. Let me start with two questions from cancer survivors. Christine asked, I had stage 2 breast cancer in 2018. It ended up being completely treated with chemotherapy, radiation, and surgery. How long am I considered immunocompromised? And am I at greater risk of contracting COVID-19? Linda asked the same question, am I at greater risk of complications from COVID-19 since I had chemotherapy twice and received radiation? It's been 7 years since my last treatment. We can provide some reassurance for cancer survivors such as Christine and Linda, but it's important to still be cautious. On Tuesday, April 28th, information was released by one of the National Cancer Research Organizations about COVID-19 in cancer patients worldwide. Right now, most of the information that we have comes out of China because the COVID-19 epidemic started there. In China, they found that cancer patients have a 2.5 to 3 times greater risk of severe problems with COVID-19. But it's certain cancers that seem to have the greatest risk. Lung cancer patients, cancers with hematologic malignancies, which is cancers of the blood and immune system, and patients who've been treated within the last 3 months seem to be the categories at greatest risk. Patients who've had breast cancer or colon cancer or other common cancers that were treated over a year ago probably are at lower risk, but you should still be cautious. Please take all steps to protect yourself from exposures to coronavirus and from catching COVID-19. Please follow all local guidance. But you can have some reassurance that if you're a year or more out from treatment, your risks are probably lower, your immune system is probably well recovered or recovering. But don't take chances nonetheless. Our information about COVID-19 is still evolving and new information could come out in the future. Eileen asked, I get bronchitis every fall. Does that make me more susceptible to a worse case of COVID-19? I am 72, very active, and otherwise healthy. Eileen and people like her, I would counsel you that you need to be cautious because of your age. Patients over age 65 have more problems with COVID-19. If the bronchitis is more due to allergies or hay fever, then it may not be an issue. We know that asthma patients don't seem to be at higher risk of COVID-19. So bronchitis alone does not increase my concerns for you. But still be cautious and take all steps that local authorities are recommending to protect yourself from COVID-19. For the next two questions, I talked with one of my colleagues, Dr. Jeff Henderson, who is an expert in infectious diseases. Marianne asked, do they know how long you're immune once you recover from COVID-19? Will they do voluntary antibody testing in time to see what kind of herd immunity is out there? Or will they allow cancer patients to be tested to see if they have any immunity or are still vulnerable? Dr. Henderson, the infectious disease specialist, answered this with, at this time, with this new virus, the duration of immunity is an unanswered question. As the test performance of new antibody tests becomes better understood and these tests become more available, we anticipate getting a better idea of how many people will have been infected. Until we know whether those antibody tests correspond with immunity, everybody needs to be regarded as vulnerable, regardless of those test results. Kathy asked, in mid-February, I became sick. I would try to go to work, but would just run out of steam and end up leaving in the late morning. This went on for over a week. I had 102-degree temperature, horrible fatigue, and no sense of smell or taste. I went to an urgent care and was diagnosed with pneumonia. I was given a breathing treatment and sent home with antibiotics. I began to feel better 4 days later. Was this COVID-19? If it was, I would be happy to donate plasma, but I don't know how to go about it. Dr. Henderson replied, "We are glad you're feeling better now. There is no way to know for sure that this was COVID-19, although it was certainly possible that it could be. When antibody tests become more available, it may be possible to know if you have encountered coronavirus with this episode. We also appreciate your generous offer to donate plasma. Right now, donors require a past positive COVID-19 nasal swab test, though it might be possible in the future to identify donors based on antibody tests from their blood. This is still to be determined. We appreciate patients' willingness to donate plasma because that can make a difference for people in the future." Thank you for listening to this video, and I want everyone to stay safe and protect yourself as much as possible from catching COVID-19.